Is Jacopo STAFUZZA. He is a PhD student from Udine in the lab of Professor Lazza, and he will present something about hemodynamic response during two different resistance training protocols in older adults with stable coronary artery disease. The stage is yours.
Thank you. Good morning, everyone. And Gaspare introduced my PhD project is focused on resistance training in cardiovascular disease population. But why resistance training compared to aerobic training? Well, resistance training is a topic understudied in this population and has many benefits for this kind of population. Like this systematic review meta-analysis gives us an insight. The author studied that the prevalence of sarcopenia in this kind of population is higher compared to other age-related diseases like dementia, respiratory pathologies, and diabetic mellitus. We can see a prevalence of 31.4%, and thus this is a big intervention for this kind of population to counteract this age-related and pathology declines. But is resistance training safe for this kind of population? Well, compared to aerobic training, as I said, is a topic understudied, and the beliefs are that heavy lifting, like high-intensity heavy lifting above 70% of 1 REM, is thought to be potentially unsafe for this kind of population, despite the strength gains that could elicit. And moreover, during heavy lifting, it is almost inevitable to perform Valsalva maneuver, which contributes to an additional rise in blood pressure. Despite the relatively low number of studies, we have guidelines. These guidelines are from ACSM, which gives us a frequency of training of 2 to 3 times a week, an intensity of 40 to 60% of 1 REM, 10 to 15 repetitions, 1 to 3 sets, and 8 to 10 exercises for the major, preferably for major muscle groups, and to use safe and comfortable equipment for this, especially for older adults. But as you can see, the guidelines are quite general. Emerging evidences are pointing towards the use of higher loads, because it emerged that lower loads and high repetition schemes, training protocols, could elicit an acute increase in blood pressure greater than higher loads and low repetition schemes, and the strength training gains are more towards high repetition, low repetition schemes. In this particular research, the authors studied 2 different training protocols: one high load, low repetition; one low load, high repetitions. 4 sets for 17 repetitions at 40% of 1 REM for the low load modality, and 4 sets of 10 repetitions at 70% of 1 REM for the high load modality. What they found, it was that for every set, the blood pressure was higher in the low load, high repetition protocol compared to the high load, low repetition protocol. The authors concluded that this could be because the work duration, the total work duration of every set, which was 34 seconds for the low load high repetition, yes, and 20 seconds for the high load low repetition. Therefore, the aim of our study was to compare 2 different resistance training protocols: a cluster set protocol, which is characterized by the redistribution of the total rest. We have 4 repetitions with an intra-rest period of 15 seconds and 1 minute at the end, and a traditional protocol where the work is continuous, 12 repetitions, and all the rest is at the end of the set, 1 minute and 30 seconds. 3 sets for 12 repetitions. The hypothesis was that the cluster set, which breaks the total work duration, could evoke a reduced hemodynamic response and also lower RTE compared to the traditional protocol. These were our inclusion criteria. As you can see, the age was from 55 to 75 years old. And this is the protocol, which, like the event of today, is still work in progress. What we did was the lower limbs, so MVC for the knee extensor on day 1, and then strength assessment of 10 REM on the leg press, horizontal leg press. On day 2, the subjects did one of the 2 training protocols, randomized. Also the intensity which they started the protocol was randomized, so they could start with 40 or 60% and with traditional or cluster set protocol. And they performed the 3 sets by repetitions. Blood pressure, heart rate, stroke volume, and cardiac output were measured, and RPE at the end of each set. So, coming to our preliminary results, these are the results of the leg press. On the left, we have 40% of 1 REM. On the right, we have 60% of 1 REM. Systolic blood pressure on the y-axis, and the various standpoint on the x-axis. Traditional protocol is on blue columns, and cluster protocol is in orange. And as we can see, there is no difference, no significant difference in the values of blood pressure between the protocols. Same story for the diastolic blood pressure, but when comparing the increase in blood pressure between the sets, we found that the increase in set 3, which is the most fatiguing, most demanding, should be the harder. Compared to the values at baseline, we found that the traditional protocol increased the blood pressure more compared to the cluster set protocol, particularly 80% increase in blood pressure for the traditional protocol and 10% for the cluster set protocol compared to baseline. Diastolic pressure was not significantly different. Future analysis will be to analyze the hemodynamics of the stroke volume, heart rate, cardiac output collected with the Physiology device, and to continue the same protocol for the upper limbs with the arm exercises. I didn't mention that the preliminary data were from 11 subjects at the moment, but we will look forward to more subjects and to complete the upper limb part. Thank you very much.
Well done, and perfect timing. Questions? So I have one. Yeah, I will arrive in 1 second. I have one. It's tricky, trivial actually. Did you measure also the RPE? Were there differences? How do the patients feel this workout?
In general, you mean?
Yeah.
Well, from the leg press we used, there was difficult start. I think because biomechanics of our leg press, it was difficult to push at the start, and it came easier at the end. So the cluster set could be influenced by this kind of biomechanics, in my opinion. And from the preliminary RPE values, there is no difference between the 2 protocols.
Hello, thank you for a nice presentation. My name is Ole Christian Berg. I'm from Università in Norway. So you did the training at 70%, but they ended up around 60% of R1RM, is that correct?
No, we choose 40 and 60%.
Okay, to compare low and high.
Yeah, kind of.
Do you think 60% is high intensity strength training?
In my opinion, or for them?
In your opinion?
No.
Okay, but why for them then? Is it not relative?
Excuse me?
Is the strength training percent not relative to the individual?
Yeah,
so is it different for a healthy person or a patient?
Well, in my opinion, yes and no, but the easy answer is no. It's comparable.
Okay. So if you have done strength training with proper high loads, like 80, 85, 90%, you would do a few repetitions, meaning less few, maybe 4 or 5.
Yeah, exactly.
The strength gains are then shown to be higher, which you showed in your first graph. Do you think you did have even less of a blood pressure response?
With higher, like 85?
Yes.
I don't think so, because the Valsalva maneuver that is required to lift those heavy loads.
I would urge you to try. We have some data that might point in that direction.
Well, thanks for the insight.
There is time for one more quick question. Yeah. So.
Brent Reiteri, Royal University, Bochum. I have a related question. Yeah, do you think it's worth doing cluster set training for such a low relative intensity? I thought the whole point of the cluster sets was when you use a very high intensity that you have additional rest and then you can still lift that higher weight.
Yeah, but if the patients, in this case, they feel that the cluster set can give them a break, I think it's worth introducing it, because in my opinion, the point of introducing resistance training to this population is to make them do the training. So whatever trick I can use to increase the compliance of the training, I will use it. But as you can say, if we stay strict to the program, I will definitely use a cluster set to do higher volumes or higher intensity for sure. I stayed in the guidelines for a safety reason mostly. That's why I stayed 60% maximum.
Thank you very much. Thank you very much indeed.